After a delay of nearly a month, California officially has a budget. Governor Arnold Schwarzenegger signed the spending plan this week, using his line-item veto power to cut an additional $660 million. Now, the governor says these cuts are needed to help the state restore a reserve fund that it could turn to in tough times. Because the majority of California's cash is tied up in federal mandates, the governor says this money would help in the event of emergencies such as earthquakes or wildfires. But health experts say the cuts could be creating an emergency of their own. Professor Jerry Kaminsky is the Associate Director of the Center for Health Policy Research at the University of California, Los Angeles.
Well, prior to this week's actions, the budget was really looking very, very bad for social programs and for education, health care in the state.
And now with the millions of dollars in additional cuts, Professor Kaminsky says the already horrible situation is now even worse.
He said that the legislature didn't do its job and pass the final cuts needed to balance the budget, so it was left to him. The bottom line is that this is a devastating budget for social services and for health care services in the state of California.
The cuts come from a wide variety of health care programs in the state, including $80 million from child welfare programs and $52 million from AIDS prevention programs. Professor Kaminsky says, unfortunately, these cuts will likely affect the most vulnerable members of the population.
Children who are currently insured through the Healthy Families Program are going to be the hardest hit by this budget. That program is going to be so severely cut back that children who are currently eligible and waiting to be enrolled in the program are not going to be enrolled.
Additionally, Professor Kaminsky says an estimated 500,000 children currently covered by the Healthy Families Program will lose their coverage. He says at this point, California's best hope lies with the federal government and its pursuit for universal health care.
The reform proposals that are being considered by Congress right now, I see as the only possibility for any kind of quick change or turnaround in California.
The governor's office defends the cuts, saying they were tough choices that needed to be made to help move the state out of this economic crisis. Ross Frazier, Press TV.